I'm Sherlyn Adkins. I'm the Executive Director of AANEM, and I want to thank everybody for participating in our first ever neuromuscular virtual fair. And so hopefully this will be a great annual event, and lots of residents can learn about the different programs and how exciting it is to be a neuromuscular physician and be with all the cool kids. So that's our goal. So I'm going to turn it over to Sandy for housekeeping issues, and then we'll let you guys each present and ask questions.
Sounds great. Well, for those of you that I haven't been talking to, I'm Sandra First, so I'm the one that's been bugging you with all of the emails about the fair, and I appreciate all your quick responses, and this is going to be an exciting event, so I'm excited for it. Probably the biggest thing is we're going to just do each program. We'll have about up to a 10-minute presentation time just to introduce yourself and your program, and a little bit about your fellowship or hospital, whatever you want to do. Then we're going to do questions. So the residents, hold your questions. We'll do that at the end. We'll have about a 15-20-minute question and answer session. So we'll probably utilize the chat feature for that. So if you have a question for one of the programs, please just put down in the chat what program you're asking a question from, and then what your question is, and then the programs will kind of monitor these and kind of take turns answering questions. Make sure you're on mute when you're not speaking, so that kind of eliminates some of that background noise. This is being recorded, so we will be posting all of the fellowship sessions on the website, so that residents that weren't able to join us live can still go back in and review them at a later date when it's convenient for them, just to review for residents that maybe were able to attend. So make sure your name is listed so that we kind of know who is who. And I find speaker view is probably the best, so that you kind of know who's speaking. Sometimes these squares get so little and it's hard to know who we're talking to. Hopefully the question and answer will work well here, but if you don't get your questions asked or questions answered, feel free to reach out to the programs through the communication tool on the portal. That's going to be an excellent resource for you, as well as just maybe emails, phones, whatever works best between you and each program. All right, so any questions there? Anything I missed everybody has questions on? Okay, so then let's go ahead and get started. And I think we have the first program is Oregon Health and Science University. So I'll let you go ahead and take it over.
Nice to meet all of you. I'm Orly, not Shaheen. I'm one of the fellows. We also have George Banks, but he's currently in the ALS clinic and unable to attend, unfortunately. But we're two fellows here in our program, and it's nice to meet all of you. Let me see if I can use his computer to share the screen. We've been having some issues with that in the past. Share screen, there you go. Okay, so unfortunately I wasn't told that we needed to present anything, but I usually talk to residents every year, so I do have an updated presentation that I do help out with our program residents to kind of try to get them engaged with neuromuscular programs. So this is something that I've used, and just recently we did add our OHSU program to the AANEM website, so it should be updated. We really just have basic requirements of completion of neurology program, and of course completion of the portal application. And usually, to my knowledge, applications are open as of January 1st, and although we will not be able to see the results until March 1st, and please correct me if I'm wrong. And then usually we interview once we get all the application in March, and we try to interview as early as possible. And then of course we make our offers as of June 1st, and then the applicants will be able to kind of tell us yes or no, and we'll go from there. So really, to be competitive for our program, you do want to demonstrate very strong letters of recommendations. We usually ask for at least 3 of them, and they should really be from providers who knows you, knows your skills, and can really strongly advocate for you. We also like a strong essay, so usually 1 page, but if you need 1 to 2 pages, that's fine, to kind of explain your interest in the neuromuscular field, to kind of at least tell us about your story or what makes you engage more in neuromuscular compared to other fields, and see if we can find any bond or help you with research when you're a fellow. I would really recommend to engage with your current neuromuscular department in your neurology residency, because it can help you kind of test the waters, see what type of patients you like to see, or what type of research you may be interested in. And also they could also provide you with strong letters if need be. Our fellowship duration is usually 1 year. We had prior years when fellows stayed for an additional year to do more research and pathology, but in general, it is a 1-year fellowship. And I think for you to be a stellar applicant, you do need to show dedication to the field of neurology and interest in neuromuscular field. And if there is any papers that you've published or case reports, it's always a bonus. I think things to avoid will be, it's better to have less letters that will be strong than to have multiples that are kind of sustained or not as strong. And I would say it's also better to show us that you've dedicated, to completion of one thing than have a laundry list of multiple things without any relationship or passion towards them. And the best aspect about OHSU, I think for us, it's really, we have a diverse patient population. We are a large catchment area, and we're also the only neuromuscular academic clinic here in Oregon. And so we do see a lot of patients and we get a lot of referrals. We have, ALS clinic and amyloidosis clinic, as well as a specialized myositis clinic. So we do see a lot of interesting cases, and the fellows really get to be engaged from day one. We let you observe and let you start doing nerve conduction study, EMGs and other things as early as possible, and as early as the fellows really feel comfortable doing. We also have a joint process with Shriners, where if you're interested, you can go and participate in the pediatric neuromuscular clinic and therefore see awesome cases of Duchenne's, etc. Our attendings are very attentive, especially Dr. Shaheen is wonderful. He's been here for a long time and has been doing neuromuscular for many years, and he really has an open door policy. I can talk to him about everything, and he really enjoys teaching. He also did a couple of fellowships in pathology, so he's an excellent neuromuscular pathologist. And one of his enjoyment, we have actually, I don't know if you can see, but we have 2 microscopes in his office, because he likes pulling up slides and teaches on the spot, or wherever we have a no-show, he'll pull up a case and we'll show a slide. So I feel like we really learn from him every day. And he does allow you to engage with clinical trials and, of course, research. If you're interested, he's open for that too. And we are actively, we usually try to publish several papers, at least for each fellow. And I've worked with him also as a resident, so I have multiple papers with him and other providers here. And then I put in some resources just to get more information about neuromuscular in general and OHSU, but feel free to either email Dr. Shaheen or me, or use the portal to engage with us at any time.
So I'm Sarah Sakamori. I'm the program director for the fellowship at Stanford. And I'm excited to really answer questions that you have about our program, and to just give you a brief overview, but focus more on your questions at the end of the session. And I followed directions to a T. I thought we had to make a big presentation, so I have one, but most of the slides were stolen from the residency recruitment presentation, so that's where they came from. So I'll just give you an overview of who we are and what we do. And again, I'm really focused on answering your questions today. So since 1998, we've trained over 35 fellows, I believe, in neuromuscular and EMG. Over half of them have gone on to academic careers, some at Stanford, Hopkins, Michigan, UCSF. A lot of our fellows do stay in California, but they do disperse nationally as well in these academic and non-academic roles. And we're really excited to help you be a strong clinician and a lifelong learner. We're part of a large neurology department, over 70 residents and fellows now, and many faculty. So it's a great community for collaborating and for catching not just bread and butter, but really unusual patients. We have 3 positions in neuromuscular medicine and 1 in clinical neurophysiology and EMG. And so we always have a cohort of 3 to 4 fellows, depending on whether we have funding for all 4 spots. The sense of community has really been important this year. We've really pivoted to telehealth, virtual learning. Now we're back to a lot of in-person experiences. We're in the middle of a major surge in COVID here in California, but I'm excited to say that our fellows, including Ken, who's on the call, we're all vaccinated on Christmas Eve. So we're seeing light at the end of the tunnel here at Stanford. We're located here in Northern California. We see patients from all over the Bay Area, San Francisco down to San Jose, but also Alaska to Hawaii to Nevada, all over the place. A lot of our patients come from the Central Valley, which is more of a farming region, tends to be more medically underserved with a lot of patients who are migrant, working in farming or production. So what this means is we have a very diverse region nearby, and that means over 50% of patients in our own county speak English as a second language, frequently making use of interpreter services. So really it brings us a lot of joy and interest to meet people from so many backgrounds. Now I'll show you our facilities. Unfortunately, we can't see you in person right now, but this is our new Stanford Hospital. It's a beautifully built brand new building with a level 1 trauma center, neurocritical care, and so on. All of the rooms are private, which makes it a lot easier to do those pesky inpatient EMGs that can get very noisy and tricky. Our neurology residents are very busy on a variety of services, and we provide inpatient consults, and even on occasion we can do inpatient autonomic testing with our autonomic group. So it's a well-designed facility. It really improves the learning and the patient experience. Similarly, our pediatric hospital was recently overhauled, has a beautiful dedicated neurodiagnostic lab, dedicated space for neurology residents. So it's a really warm, colorful place for children, and for those pediatric neurology candidates, you'll spend a lot of time here. But overall, we spend most of our time at the Neuroscience Health Center, which is home to neuroimaging, PET MRI, neuropsychology, neurorehab, neurodiagnostic lab. We have neurosurgeons and neurologists all walking the same hallway. So again, a lot of great multidisciplinary care, and we'll see the highest volumes around of really interesting cases. We also have a wellness center, so patients in non-COVID times can have support groups and do fitness classes, and it's a really special place to work. We're very lucky to be here. And here are some team members in action, Julie and Pam from Neuro-OT and PT, and our colleagues in the diagnostic lab and the clinic. So we're part of a large department, but we crosstalk with a lot of different specialties. And so again, we can collaborate on many unusual cases and be forwarded a lot of interesting cases. Within that department, we're one of the larger divisions, but luckily our fellows do spend time with every single one of these faculty over the course of the year. You can see there's a lot of diversity, not just in terms of interest, but also seniority, research. And so I think the fellows feel very comfortable finding career mentorship and advice within our group. And I'm highlighting, just for fun, a couple of famous faces. You probably recognize Ewan, our former AANEM president this year, and Les Dorfman, a president a few decades back. As a group, we support a lot of clinical trials in addition to seeing a lot of interesting patients. We also have a wonderful team of OTs, PTs, nurses. Not everybody's pictured here, but these folks also educate our fellows. So this is an example of what a year could look like. That being said, this changes every single year. It's never the same because it really depends on the individual fellow's interests. So for example, you might have 4 months of a neuromuscular general clinic and a neuromuscular immunology clinic, 4 months of the MDA, ALS, and neuromuscular pulmonology clinic with Michelle Cow, neuromuscular pulmonologist, and finally, a block of pediatric training in the pediatric MDA clinic and including some pediatric EMG. Again, this will really vary. A pediatric fellow will spend a lot of time in a pediatric block. Those with other interests might cut some of that time out for more electives. It's really tailored to your interests. But our fellows wanted me to highlight that we have protected time for didactics, which I'll talk about, a continuity clinic for you as a fellow to take ownership of decision-making and care coordination, and opportunities for a lot of interactive learning, not just passive lecture-based learning. So again, they really wanted me to highlight those elements, but I'll also highlight our neurodiagnostic lab. You'll definitely be able to check out some unusual skill sets, and all of the fellows will learn neuromuscular ultrasound basics, and that's becoming an essential skill set. So we're really excited to offer that. And autonomic testing is another area you can explore if you'd like. So the didactics, again, we don't want them to be passive. We want the fellows to feel comfortable asking questions, to be active learners. So we have a lot of interactive meetings, debate clubs, journal blitzes. This is not the 30-minute talking about chi-squared kind of journal club. We really try to think about applications of what we're learning. And there are a lot of other learning opportunities outside neuromuscular medicine with the Neurology Grand Round series, our lab meetings, and so on. So we protect this time. We make sure the fellows can take advantage of all these opportunities. And we also offer elective experiences with a number of other providers. Again, it's totally tailored to your interests, your needs. And we're always excited to understand your career goals so we can design a program around you. Now, we strongly encourage our fellows to do a 2-year training program. This is true across all of Stanford Neurology Fellowships and certainly true of neuromuscular fellows. And we can talk more in detail about what this entails, but we think this makes you a better neurologist because you've had more graduated autonomy and more opportunities to still grow as a researcher and as an educator. And this could take the role of participating in clinical trials. We have excellent clinical trials presence and many relationships with patient advocacy groups. Our fellows wanted me to mention the UDN, the Undiagnosed Disease Network, in collaboration with the NIH. We're one of a handful of programs that is lucky enough to participate in this. Basically, your Dr. House. You're on a multi-D team analyzing mystery cases that hopefully are a lot nicer than Dr. House. And we do a lot of outreach via YouTube. In pre-COVID times, we'd get together with patient groups. In COVID times, we're doing this all over Zoom, but we're very engaged in our community. And I'm highlighting also that we're embedded right in the university campus. So you've got the medical center, the neuroscience center, the university, they're all in one place. And what this means is you can collaborate easily if you want to launch research of your own. Vessel Fecto is our former fellow who brought our R25 project over to us, looking for a great mentorship team across multiple schools of the university. So again, it's a very exciting place to be. There's a lot of collaboration. I'll also mention that we're passionate about teaching. Our medical students actually have honored us by voting us to be their favorite clerkship for almost 10 years running. And our fellows certainly maintain this passion. They spend a lot of time with our residents who are pictured here, who do a mandatory neuromuscular EMG rotation. But you can also develop further as an educator by taking courses through the Teaching and Mentorship Academy and other groups. So you can graduate a better educator than you arrived. And I think that's great for your development. We also recognize our responsibility here at Stanford for improving diversity in neurology, in medicine, in academia. There are a lot of concrete programs making tangible progress in these areas. Fellows can absolutely participate, learn how to lead, learn how to advocate, and be trained to improve this across medicine. And our fellows also asked me to highlight the sense of community they have. They like to hang out with other non-neuromuscular fellows. I think this promotes well-being. They feel very comfortable seeking out answers to questions, getting mentorship. Well-being, you know, it's a double-edged sword, as one fellow put it the other day. You know, we don't just tell you to be well, we want to show you how to be well. And there's a lot going on in that regard and a lot of very tangible advice on getting started in your career. And finally, you know, it's a beautiful place to work and live. Our fellows work very, very hard. Even though they're not taking midnight call like a stroke fellow might, they're very, very busy. And so when they're not at work, they're very fortunate to enjoy a wonderful quality of life. You can see some of what they were getting up to here. Some of this is pre-COVID. And even though we're doing everything online now, we're still able to get together and have fun as a division. I will mention that Stanford has been very generous in trainee benefits. I'm happy to talk more about that. But we do think it's important to ensure that you feel supported and healthy, that you can attend meetings, and that all of this helps to promote a great fellowship experience. So again, we take a pretty holistic approach. We want to help you develop. We want to help you plan in the short term and long term. And I'm excited to tell you more, so feel free to send questions.
So I'll be talking about the University of Washington. We're up here in the Pacific Northwest in Seattle, and we have a typically a 1 year but extendable to 2 years fellowship for neuromuscular medicine, and we we have a dedicated pediatric track as well. Let me, let's see if I can share my screen. Okay, can you guys see this?
We can.
Okay, great. Yeah, so anyway, thank you for joining us. So we have, typically fellows do a one-year fellowship. Some do decide to stay for a second, and that's primarily doing on the research side of things. We typically have 2 fellows for neuromuscular. In addition to that, we also have 1 or 2 neurophysiology fellows as well every year. And we, you know, it's a big program in terms of neurology's presence here. There's a large residency program with over 30 residents, and we have, you know, a large hospital system, 4 main hospitals: the University Hospital, the County Hospital, Seattle Children's, as well as the Seattle VA. And so, you know, we all have these diverse patient populations, and we have a core 6 members, 6 attendings for the neuromuscular division, and so we do plenty of clinical care. As you might know, University of Washington is always renowned for you know, primary care and really taking care of the population here, but also in this entire region of the country. And so what they call the WWAMI region: Washington, Wyoming, Alaska, Montana, and Idaho. And so, it's, you know, we have patients who come here from other states. And so there's a lot of interesting cases, mystery cases, zebras. They sort of, 5 states get funneled to us. And so, you know, there's plenty of clinical care to go around, but the attendings here also, we all have our own areas of interest in terms of research. There are studies going on anytime with ALS, myasthenia, inflammatory neuropathies, and then also pediatric diseases and muscular dystrophies and such. Dr. Seth Perlman, he is our program director, and he's in clinic right now, which is why I'm with you. And you know, the other thing I want to highlight is just Seattle is a great place to live. You know, I think the location draws a lot of people here. You know, when I came here the first time, I didn't want to leave because you have, you know, you have the water, you have the snow-capped mountains in the direction. Great hiking, great water sports. The summers are beautiful. You know, I'm from California, and so the first winter was pretty tough, but you take a vacation in January, and it's not as bad as people say. And you know, I think our fellows are very happy here. So our 2 fellows typically they switch every 2 months in terms of their sort of main location. One is primarily based at the University Hospital, and one is based at the VA. And then there's other experiences that they get exposed to as far as Seattle Children's and the county hospitals. And so there's really a wide range of things that they get to see. The fellows also participate extensively in education. They're responsible for teaching each other, but also if they choose, participate in teaching of the residents here. And you know, recently we've had plenty of residents, internal residents, who have been interested in the program as well. So that speaks to the strength of it. And yeah, you know, I look forward to answering your questions, but you know, the typical application process would include a CV, 3 letters of reference, and you can contact Miranda Skillen, which is shown here, and then Seth Perlman, his email is listed on the bottom. And yeah, look forward to talking with you more.
Hello, everyone. So I'm Jeff Ralph. I'm the program director for the UCSF Fellowship. Let me share my screen. Thanks to you folks, the AANEM, for setting this up. Thank you. And I also want to introduce Victor Saunders, one of our fellows, who's also joining us. So I'd like to tell you about our fellowship program. If you have questions, you can contact me or Victor at the emails at the bottom of the slide. And this just shows some of our well-adjusted fellows in our program here at UCSF. So this is a one-year fellowship. At UCSF, we transitioned from a clinical neurophysiology fellowship to neuromuscular medicine back in 2016. And at the end of the fellowship year, you can sit for the ABPN boards. If you completed a PMR residency, you could sit for the ABPMR boards, and you could sit for the ABEM boards as well. And our fellows rotate through neuromuscular clinics, an ALS multidisciplinary clinic, MDA clinic, our multidisciplinary nerve injury clinic, and EMG clinics. I'd like to tell you a little bit about some of the core faculty. They include John Engstrom, our residency program director, who's, I think one would consider the dean of program directors in the country. He has a clinical interest in spine disorders. Down below is Victoria Iriadenko. She directs the VA neuromuscular program and directs the ALS clinic at the VA in San Francisco as well. Kathy Lomenherth, she is our division head, and she directs our ALS center. She did much of the seminal work in FTD ALS. Down below is Ann Poncelet. She's the director of our Academy of Medical Educators, which is a prestigious organization here at UCSF that's sort of tasked with providing an environment that's conducive for education at the university. So she has a keen interest in medical education, also the intersection of neurology and rheumatology. And then there's me, and I've directed the fellowship since, as I said, since 2016. I've had an interest in HIV neuropathy, do laryngeal EMGs with some colleagues, ENT, and muscle channelopathies. Laura Rosso is the Associate Director for the ALS Center. We have two pediatric neuromuscular specialists, Jonathan Strober and Alex Fay. Jonathan directs the MDA clinic. Alex has an interest in the genetics of childhood onset neuromuscular disorders. And then these are some other faculty members that you would interact with. As it turns out, these members all are graduates from the fellowship program. Other people include Bob Laser, who's a retired clinician that is still involved with our teaching, and he is, the Resident Teaching Award is named after him, which is, reflects his awesome teaching abilities. And then in our department, and this is the prior head of our division, is Michael Amanoff, who is the former editor of Muscle and Nerve for 10 years. Among his many accomplishments is being the editor or author or editor of 29 books or so and counting. So our fellows go to one of three sites, the VA, which is located at the upper west corner of the San Francisco Peninsula. But most of the time is spent at the Parnassus campus, which is right in the heart of the city near Golden Gate Park. And then close to the Golden Gate, the Bay Bridge is the Mission Bay campus and UCSF Mission Bay. As others have mentioned, COVID-19 has really affected our fellowship program like it's affected everything. Here are our fellows from last year wearing their masks. And all of our educational conferences were transitioned to Zoom. But I think when you folks join our fellowship, things should return, fully back to normal. And largely things have already returned to a somewhat typical state where, most of our encounters are in-person encounters. This next slide, the next two slides show our fellow schedules, and I'd like to go through this briefly. So the fellows rotate back and forth between these two fellows every month. So Victor would do this schedule for a month and then rotate to the next schedule and then go back to this one. So the fellows do have a continuity clinic. There is some time set aside for working on presentations or research. Tuesday has the spine clinic and our nerve injury clinic in the afternoon, EMG sessions. Wednesday afternoon is reserved for departmental conferences. And then our fellowship conferences are concentrated on Friday mornings. That's when we have our pathology conference. This is when the faculty teach to our fellows, and also when our fellows teach to us. Our fellows lead a weekly conference, and this takes the form of a journal club, but sometimes a topic review. And then EMGs in the afternoon. And then this is the other schedule. So this fellow has a number of EMG sessions, as you can see, a neuromuscular clinic in the afternoon on Monday, MDA clinic at Mission Bay on Wednesday morning, ALS clinic Friday afternoon, and the same conferences and other teaching sessions. So why come to UCSF? Well, you know, I think our Department of Neurology has a lot to offer. It is one of the largest departments in the country, and as others have sort of said about their own departments, I mean, we have something like 150 neurologists in our department. So if you have an interest in something, you want to learn about something or pursue research in something, there are people here that can really help you on your path to learning whatever it is. The other big thing is, I mean, San Francisco is such a distinct place to live. So I think if you're thinking about doing a fellowship here, you really have to think about how you feel about San Francisco. And, you know, for me, you know, when I was in college, I sort of fell in love with San Francisco on a trip, and I was desperate to move to San Francisco. And I think even still, sometimes there are times where it almost feels like a Disneyland for adults, doing various activities in the city. So it sometimes is a real wonderful place to be. Of course, there are negatives, including the high costs and other things. But I think it's a great place to spend some time in your life. Another special thing is that we do have a training and clinical research program, and our fellows are offered to participate in this program, but it's not mandated. Victor and Eric, our other fellow, chose not to do it. It's up to them. We also, this is a sort of a plug for our region. There are these NorCal neuromuscular meetings, and I must tip my hat to the Stanford folks because they took the lead in organizing these meetings. And in the past, we still move the site of these meetings around, and in the past they've been at UCSF and some at Stanford and some at other locations. We do have a housing stipend, which helps with the high expense of housing in the Bay Area, and we pay for all expenses for an annual meeting and any meeting at which you present. We also pay for the board exams as well. The muscle and nerve biopsies are performed by Dr. Lynn Jacques in neurosurgery. Our muscle and nerve readouts are written by neuropathologists here at UCSF. Our fellows do quality improvement and M&M sessions at our quarterly division meetings, although right now we're holding division meetings much more frequently during the COVID-19 pandemic. This is a list of some of our prior fellows. We have 2 fellows per year. As you can see in recent years, this is sort of incestuous. They've sort of, I don't know what the term is, but everybody's sort of stayed on. But Brian, he's a major in the Air Force, and he went to the Air Force, but is stationed at Travis Air Force Base, so he's not too far away. And this is just a picture of some of our recent fellows. This is Noriko Anderson and Paul Sempanero, who again joined the faculty with us. This is Mark and Brian. Brian went to the Air Force, and Mark joined the faculty. So the requirements for applying to the fellowship program are, I believe, on the portal. So please refer to that to know what you need to do to apply. Thank you.
Start with the question about numbers at Stanford. So before the AANEM created this really much needed portal and uniform application process, we did have people applying years in advance to the fellowship. So that's why not all of the positions are available, because some were filled far in advance. Right now we have 1 position available for 2022 start date and possibly 2. So check back in a few weeks. It depends on a funding decision. And while I have the floor, I'll also mention, I don't know if I was clear about this in the presentation, We also have a peripheral nerve injury program, much like the folks at UCSF, working with TJ Wilson, who's a great peripheral nerve surgeon, myself, and others doing neuromuscular ultrasound and MSK MRI. So I'm happy to talk more about that, John, if you have more questions.
So I think I'm up. So hi, John. So yeah, we have a multidisciplinary nerve injury clinic. It's actually going on right now. And how this works is in the early part of the afternoon, patients come and these patients have traumatic neuropathies, things like brachial plexopathies from motorcycle accidents, gunshot wounds, things like that. In the early part of the afternoon, EMGs are performed. And then we meet as a team at 4 o'clock with our neurosurgery colleagues. And the main surgeon that's involved is Dr. Lynn Jacques. She's a surgeon who specializes in peripheral nerve repair. And we integrate information from ultrasound and also MRI studies to plan the surgical intervention for these patients. Often what happens is we decide to follow the patient over time, and we do serial exams and serial EMGs and to manage their condition. I see there's a question about, so I don't know, Victor, if you want to address the question about what you feel are the particular strengths of the UCSF program.
Sure. I think UCSF, something that I really wanted out of the fellowship was, I feel like in residency, you get a lot of great training with inpatient neurology and general neurology, but probably neuromuscular is one in peripheral neurology is something that is not focused on as much in residency. So I really wanted a program that would offer a lot of training, especially in EMGs. And I think at UCSF, you get definitely more than enough time to become proficient with EMGs. And so that's definitely one strength. And I think there's also there's a really kind of a diversity of different patients that you see here in the different clinics. We have, which I think Dr. Rolf already said, I don't have to speak for that, but there's a lot of clinics here that you get to see with patients with all sorts of kind of rare conditions, especially a lot of kind of different genetic kind of hereditary neuropathies. So I think there's no shortage of kind of interesting cases here that you'll get exposed to. And the nice thing is also you get to kind of see those patients in clinic and then kind of frequently get to do the EMGs and kind of get to that interesting diagnosis afterwards. So there is a kind of a good chance for follow-up built into that fellowship.
And our fellow Ken is on the call, so maybe Ken can tell us what he thinks. I'm happy to leave, Ken, if you want to speak the truth.
No, I'm happy to be as candid as possible in terms of answering any questions out there. It's interesting because just as I was thinking about this, it seems like it's been so long since I was a resident, but it was really only just kind of 6 months ago that I was in your seat. And so the approach that I took in terms of going into neuromuscular and choosing a neuromuscular fellowship was that part of that was just knowing that neuromuscular wasn't really as represented as some of the other subspecialties in neurology, particularly during residency, which is so much more inpatient heavy. And so, there's so much to learn during the neuromuscular fellowship year that it almost sounds like 1 year doesn't sound like enough time to kind of learn everything. And so some of the things I was thinking about in terms of choosing a program that I think would be the best fit for me was that I wanted to go to a place where there were a variety of different mentors with different interests. I wanted to go to a place where there's a strong focus on clinical education and teaching, which I think I've been really happy with at Stanford. Everybody's really invested in making sure you really learn the basics of neuromuscular, as well as helping you kind of tailor your interests and join them in any research or any particular clinical or academic interest that you have. One specific interest of mine has been medical education. And so with the help of Dr. Sakamori and some of my other our other mentors, I've been able to spend some of my time also teaching medical students and residents. And so I really enjoyed that.
Orly, did you want to speak again?
Thank you. Yeah, I was waiting to see. I didn't want to interrupt. I think, you know, I agree with all the fellows here. I think we all go into neuromuscular because we're so passionate about the field. And I think what I love about OHSU is that it did let me to engage as of day one. I think with other programs where I heard that there is several blocks, you do, you know, a few blocks clinical and a few blocks EMG. What I like here is that we kind of, every week is very diverse. We do, you know, every week we have myositis clinic and ALS and MDA and our own continuity clinic. And with that, we also do about 30 to 40 EMGs a week. So I feel like we're really hands-on, we work hard, but we really love it. And the days go by really quickly just because of how much we engage and we enjoy what we do. We do get 2 half days, so you do have downtime for learning. And like I said, with Dr. Shaheen, we have journal clubs, we do pathology, and so we are actively engaging as well. So I feel like we do learn a lot, and we are busy most of the time. And like I said, there is opportunities in research. If we see interesting cases, we always love to publish them, and we've done several retrospective trials here that we published as well. So I think really the take-home message is that whatever you're interested in, Dr. Shaheen will make it happen. He'll, you know, you guys will have long conversations, and he'll try to make it as you know, special to you as anyone.
Are there other fellows on the call? Maybe I'll answer this question about how we've integrated neuromuscular ultrasound into our training. So we have a formal and bedside process for learning. You know, the formal process is lectures covering the essentials of the physics, the principles of evaluation, interpretation, some evidence-based approaches to interpreting nerve swelling, and so on. So over the course of the year, we're delivering those lectures. In the EMG lab, I have 2 to 3 half days a week where my patients are getting EMG and ultrasound in the same encounter. And so the fellow will be present for all of that. Early in the year, I'm, you know, showing, and then later in the year, they're actively doing it on their own, of course. But it's a no pain, no harm procedure, so fellows can experiment all they like on the patients. One cool thing that's happening is we're transforming from one EMG company to another. We now have all these Cadwell machines that have built-in ultrasound. So in the next couple of weeks, those will be live. And that means that the fellows can easily transition from EMG to ultrasound in any patient, regardless of whether I'm around. The other thing we're exploring is a tablet-based ultrasound, which we borrowed from Philips, that we can maybe take to the ICU to look at diaphragm function in intubated patients. And going back to the peripheral nerve program, TJ Wilson and I, our nerve surgeon, will often have same-day clinics. So the patient will have EMG and ultrasound, see him, then he and I will discuss a little bit, come up with a plan. And we also have a peripheral nerve team that meets at 7:30 every other Tuesday morning. So I can't say the fellows always dial into that because it's 7:30 in the morning, but there are a lot of ways to get more experience in that arena if you're interested.
Thank you very much. Do we have any other questions out there? We're a smaller group, so I mean, if anybody wants to just come on camera and ask a question, you're certainly welcome to do that.
I wondered if our neuromuscular people would like to give a plug for why you should choose a neuromuscular fellowship versus a different fellowship. You've talked about your programs, but I mean, if they're thinking about neuromuscular versus epilepsy versus something else, why choose neuromuscular? What excites you about it, and why did you go into it?
I can try to field this question.
Okay.
You know, I'm sort of, let me think, I'm 5-ish years out of fellowship, and I think I may have taken a slightly different route than other people. You know, for me, when I was a resident, I really wanted to stay a generalist. But then what I realized at the end of my residency was that neuromuscular was somewhat of a black hole for me. And that, you know, out of all the subspecialties within neurology, neuromuscular was by far seemed like the one that was that had the largest sort of fund of knowledge. And so so I really did a fellowship because I wanted to sort of complete my education in neurology. But you end up sort of liking what you're good at. And then in retrospect, it was the best decision I made because you know, you probably encounter this. I feel like people in other specialties are often scared of neuromuscular conditions, and so you know, armed with this knowledge, you really kind of become an expert amongst experts. And then for me also, you know, EMG is sort of, you know, one of the only hands-on procedures that we do as a neurologist. So if you like that process of really, you know, getting your hands dirty, I think EMG just made perfect sense for me.
I was just going to say,
Go ahead, Jeff.
It's a very rewarding field because you can look at a problem from a clinical physical exam standpoint, from an electrodiagnostic standpoint, an imaging standpoint, and you are doing those evaluations, and then also from a pathological standpoint. And again, you are taking the lead in those investigations. So really taking a diagnostic question from the beginning to the end is extremely rewarding. And I think doing, and Max sort of said this, you know, doing an EMG is also a very nice antidote, I think, for clinic experiences. I mean, as much as I like seeing patients in the clinic, I think if you were to do it that day, if that were your only activity, I think you would go a little crazy. And being able to sort of go through the flow of doing a procedure is a nice counterweight to the clinical encounters. So it's a very enjoyable job to have.
I would second all of that, or third all of that, and then I would add that right now the field is evolving so rapidly. Like, we're seeing progress over not decades and years, but even months. It's really amazing to see what tools we have. So many of us got into the field thinking we like anatomy, we like procedures, we want to help patients cope with neuromuscular disorders, and now we're saying we want to cure and eliminate neuromuscular disorders. This is really one of the last frontiers in medicine, I think. There's a lot of mystery remaining in neurology and neuromuscular, and that mystery is being uncovered every day. So, you know, you'll never get bored as a neuromuscular doc. You'll have hard work, and there's a lot of variety, almost too much. You feel like you can't cover everything in your fellowship, but you'll never get bored, and it's a lot of fun.
And I think we do the best exams.
I'll second that. I wanted to say similarly that I just love neuromuscular. I love the diversity. I like the complexity. As a resident, I enjoyed epilepsy and, you know, Parkinson's, all the neurodegenerative, and MS, but I felt it was very standardized. Even stroke, I felt like it's all kind of protocolized, very standardized. Localization is not as difficult. And with neuromuscular, it's really open. You know, you have to decide, is it upper motor neuron? Is it lower motor neuron? Is it nerve, spine? Do I want to do EMG, which I consider to be an extension of the physical exam. It gives you so much, you know, beneficial information. You can do a skin biopsy, which we do here, a muscle biopsy, and kind of really kind of close the loop. And of course, do a, you know, if not all, you will be an excellent physician. Like, you would be able to do a very strong neurologic exam, which is valued in any field, even if you decide not to continue with neuromuscular thereafter. For me, what I love about it is I can today, you know, 4 or 5 months in, I can look at a patient, do an exam, and know exactly what I think he has going on. You know, whether his complaints are because of neuropathy or because of a myopathy, is his Sjogren's causing his breathing disorders and other, you know, autoimmune diseases. So I just love that every day I can see a different patient, and it's really diverse.
You're like Sherlock Holmes, but in the 21st century.
And no two patients are alike. I feel like even with myasthenia, they're all very different.
Yeah. And the national community is just the right size. Like, you know, we all know each other. You know, we see each other often at meetings here in California. We all interact, we share patients, we share residents and fellows. And so I think there's a lot of opportunity to meet leaders in the field, even at a very junior level, and to make a mark on the field. You know, it's not like everything's already been done. There's so much more that you can contribute to in our field.
Thank you, guys. That was excellent. Makes me want to be a neuromuscular physician. Maybe I can go back to school. And you get to come to AANEM's meeting, which is the most fun meeting of all the meetings, of course, too.
Absolutely.
So don't forget that. Don't forget that. All right, does anybody else have any other questions or comments? So great, thank you all for coming. And as Sandy mentioned, we'll have this recording on the website so that other residents and fellows can, or not fellows, other residents can listen and learn. And we look forward to having you in the future be a part of our organization. Thanks.